This is Norma Basalis. Norma Basalis is divided into three parts, that is interior, middle and posterior part, by two lines, that is interior part from the middle part from the hard palate and middle part from the posterior part by imaginary line from the foramen magnum. Okay, now we're going to discuss about interior part. Interior part bears sockets for alveolar arch which has teeth. It has hard palate which is pitted form. The hard palate consists of upper 2/3 of maxilla, palatine process of maxilla, and lower 1/3 of palatine bone. So it has cruciform suture, that is cross line, interpalatine suture upper 2/3 and interpalatine suture lower 1/3, and palatomaxillary suture. Just in front of the palatomaxillary suture there is a foramen called greater palatine foramen. Behind greater palatine foramen leads to greater palatine groove, which leads to incisive fossa or incisive canal. From incisive fossa or canal, nasopalatine nerves emerges. In front of greater palatine foramen there is 2 or 3 in number lesser palatine foramen. So this was the interior part. Now we can see about the attachments. This is the crest, palatine crest, where palatino-aponeurosis attach. This is spine, nasal spine, where musculus uvulus attaches. Okay, in the hard palate, posterior part of the hard palate, there is attachment of tendon of tensor valley palatini muscle. This is pterygoid hamulus, pterygomandibular raphe. This was the interior part. Now, posterior, middle part. Middle part consists of pharyngeal tubercle. Pharyngeal tubercle has pharyngeal tonsil. Same, it has attachment of rectus capitis, lateral capitis and rectus capitis just in front of the condylar canal. This is condyloid process, foramen magnum, pterygoid plates, medial pterygoid plates, lateral pterygoid plate. This is scaphoid fossa. Petrous part of the temporal bone, and this is this is tympanic plate, and tympanic fissure is this. Petrotympanic fissure is this. Mandibular fossa, mastoid process, spine. Okay, and this is the temporal part. So middle pterygoid plate and lateral pterygoid plates, in between them there is pterygoid fossa, V-shaped pterygoid fossa. This is scaphoid fossa. Attachments are here are in the medial part of the lateral pterygoid plate there is a deep head of medial pterygoid muscle, and in the lateral part of the pterygoid plate there is lower part of the lateral pterygoid muscle. Superior constrictor muscle attaches in the pterygomandibular raphe and pharyngeo-basilar and basilo-occiput. This is condylar process. Foramen magnum has interior part, posterior part. Interior part attachment is I don't know, and condylar ligament are attached here. Here ligamentum nuchae attaches, which attaches to the superior nuchal line. This is occipital protuberance. Foramen ovale, foramen lacerum, and foramen spinosum. From foramen ovale, there is emission of male, that is mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and imaginary vein. From foramen lacerum, which is present here, from foramen lacerum, there is emission of imaginary veins, cartilages as well, greater petrosal nerve, and meningeal branch of ascending pharyngeal artery. From foramen spinosum, there is emission of transmits middle meningeal artery, meningeal branch of mandibular nerve or nervus spinosus, and posterior trunk of the middle meningeal vein. This is carotid canal. Here jugular fossa. From jugular fossa there is jugular foramen में से jugular nerves arise होती हैं. Interior jugular vein, posterior jugular vein. From foramen magnum transmits apical ligament of dense vertical band of cruciate ligament, membranous tectoria, and through the wider posterior part, lowest part of medulla oblongata, 3 meninges, and through the subarachnoid space there pass spinal accessory nerves, vertebral arteries, sympathetic plexus around the vertebral arteries, posterior spinal arteries, and anterior spinal arteries.